vulnerable populations. We have been monitoring emergency department visits, but there has not been any direct link. So we look for things like GI illness, and we're looking for that on an ongoing basis, but those levels sort of fluctuate given any time of the year, but none of those cases have been directly linked. I want to be clear that the advisory level, we would not expect to see any illness. This is for vulnerable populations. The majority of adults can drink the water. Some of the recreational water advisories, like is on Detroit Lake right now, are at least 10 times higher. And again, even at that level, we're doing that as a precautionary, not because we would expect to see illness.
So, may I follow up? So, to clarify, this is a question I had. Drinking the water is not the same as swimming in it and all those other things that, where you say the concentration is much higher and they're warning people not to even touch the water.
Yeah. So there's a couple of routes of exposure to toxins. Certainly one of them is if you drink, it can get in your GI tract and cause some direct, so we know that it can cause GI illness. Another is if you have contact with skin, it can cause a rash or irritation. So when we have, and then we know also when people swim in a lake, occasionally if you're swimming, especially if you've got your face in the water, you may be drinking some or have contact with mucous membranes. So again, the recreational advisory is both, but it's at a level we would not expect to see illness in people. Primarily when we're talking about this drinking water level, again, is for vulnerable populations in higher quantities that they would be drinking. Does that make sense?